The following video demonstrates an arthroscopic rotator cuff repair technique utilizing a biocomposite scaffold for insufficient tissue quality. The patient is a 51-year-old right-hand dominant laborer with an injury sustained over 10 months ago. His MRI demonstrates a 2.5 cm retracted tear with grade 3 atrophy. After preparation of the subacromial space, the tissue quality is evaluated and noted to be atrophic and poor. After decorticating the greater tuberosity, 2 anchors are placed percutaneously into the medial margin of the greater tuberosity. Each of these anchors is equipped with a self-tensioning tape as well as a standard fiber wire suture. After placement of the anchors is complete, the tapes are brought as a unit through the rotator cuff tissue using a looped suture passing suture. Once the tapes have been passed together, each limb of the fiber wire suture is individually passed through the rotator cuff tissue just posterior to the initial tapes. This is again repeated posteriorly, with the tapes being passed at the most posterior aspect of the rotator cuff tear, and the remaining 2 fiber wire sutures passed individually just anterior to this, keeping all 4 limbs of the fiber wire between the sets of tapes. The 2 groups of the fiber wire sutures are then tied down together for a medial compression. They are saved for later passage through the biocomposite scaffold. Next, in a suture bridge configuration, 1 limb of the anterior tapes and 1 limb of the posterior tapes are brought laterally to the articular margin and secured down using a 5.5 mm self-punching anchor. This is again repeated posteriorly to complete our double row rotator cuff repair. Next, the fiber wire sutures are brought out laterally and each limb is individually passed through the most medial margin of the biocomposite scaffold. The graft is then shuttled back into the joint using a suture passing device. The 2 limbs of the fiber wire from the anterior portion of the biocomposite scaffold are brought out and tied down in a simple half hitch for compression and stability. This is again repeated posteriorly. Again, using a suture bridge configuration, we take 1 limb from the anterior portion of the fiber wires and 1 limb from the posterior out laterally and secure this down into a 3rd row with a 2.9 mm anchor. Care is taken not to overtension this. Once complete, a survey is undertaken of the biocomposite scaffold to ensure there are no edges which need to be tacked down. As noted, this graft has been rehydrated with blood and throughout the process has maintained the blood within the confines of the scaffold.